Well, they figured out that even though we have MS, exercise is good for us after all. Now they're just trying to figure out what type of exercise is best for what symptom of MS. Well, hello, and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam. I've been living with multiple sclerosis for 40 years, and today I have a longish video, so I want to get right into it. We're going to look at 3 articles that appeared in Multiple Sclerosis News Today over the last year, and they all talk about meta-analyses, which are studies of studies, basically, looking at all the conclusions from various studies on exercise and whether it benefits MS and what kinds and what symptoms, to see what we can glean from that. So to start off with, let's look at the 3 articles. This article for Multiple Sclerosis News Today was published on December 20th of 2024. It's called Exercise in MS Eases Fatigue, Improves Muscular Fitness Analysis. Optimal exercise type differs for each outcome, data from 84 trials show. And they say that exercise effectively reduces fatigue and improves muscular fitness in people with multiple sclerosis, though the optimal exercise type and dose differ for each outcome according to a meta-analysis of published studies involving more than 3,500 patients. Mind-body exercise, which combines physical movement, mental focus, and controlled breathing, was the best exercise mode to reduce fatigue, the analysis found. In contrast, high-intensity interval training, known as HIIT, features intense bursts of exercise followed by a brief recovery period, was best for muscular fitness. Among non-pharmacologic management, exercise can be a beneficial rehabilitation approach for MS, particularly for reducing fatigue and addressing mobility problems, the researchers wrote. According to the team, the optimal amount of exercise needed to reduce fatigue was 650 MET minutes per week, a measure of the amount of physical activity in an exercise regimen. This corresponds, for example, to 165 minutes or slightly more than 2.5 hours of yoga per week. For improving muscular fitness, the most effective dose was 530 MET minutes per week, which corresponds to 75 minutes or slightly longer than 1 hour of HIIT. The study, Comparison of Different Exercise Modalities on Fatigue and Muscular Fitness in Patients with Multiple Sclerosis, a systematic review with network and dose-response meta-analyses, was published in the journal Frontiers in Neurology. They say mind-body exercise is the best for reducing fatigue in MS, analysis finds. In MS, the immune-mediated damage to the brain and spinal cord often leads to problems with gait or walking and balance, as well as muscle spasms. Such symptoms can contribute to fatigue, which is marked by feelings of exhaustion when performing daily activities. A physical exercise regimen is often recommended for MS patients. It can help prevent or delay functional declines, ease symptoms, and improve overall physical fitness and quality of life. Various exercises have been proposed for MS patients, including resistance training, aerobic exercise, HIIT, and mind-body exercise. Resistance training or strength training, such as weightlifting, is designed to increase muscle strength and improve endurance, while aerobic exercise increases heart rate and the amount of oxygen the body uses. Now, a team led by researchers at Chengdu Sport University in China conducted a pooled analysis of published studies investigating the impact of different types and amounts of exercise on fatigue and muscular fitness in MS patients. There is a need to further conduct systematic research on exercise modality and dose for MS patients to determine the minimum effective dose, the optimal dose, and the maximum safe threshold of different exercise modalities, the researchers wrote. Following a database search, the team selected 84 randomized controlled trials for their analyses. These studies included 3,786 participants with a mean age of 42.5 and an average disease duration of 8.4 years. Exercise frequency varied widely, ranging from 1 to 14 weekly sessions, and each session typically lasted about 51 minutes. Compared with control groups, the exercise intervention that was most effective in significantly reducing fatigue was mind-body exercise, which includes modalities such as yoga and Pilates, followed by resistance training, a combination of aerobic and resistance exercises, and then aerobic exercise. Sounds exhausting to me. I don't know about you. HIIT was the sole exercise that didn't significantly reduce fatigue levels in patients versus the control the data showed. And I'm glad of that because HIIT, I've tried that a time or two, and I'll tell you what, it makes you so exhausted you can hardly stand it. Getting your heart rate up that high for that short burst even is enough for me. It triggers my fatigue. So maybe it wouldn't work the same on everyone. They said that regarding muscular fitness improvements, HIIT was the most effective exercise, followed by a combination of aerobic and resistance exercises, mind-body exercise, and resistance training. Here, aerobic exercise was the sole intervention that did not improve muscular fitness in patients relative to the controls. And of course, more research is needed to determine optimal amount of exercise. The team then used a measure called MET, minutes per week, to calculate the amount of energy used during exercise for each patient. 1 MET is essentially the amount of energy spent at rest or when a person is sitting quietly. In comparison, a person doing yoga is estimated to use 4 METs per minute, while HIIT involves 7 METs per minute. Overall, the analysis showed a nonlinear dose-response relationship between total exercise in MET minute per week, fatigue levels, and muscular fitness. In particular, fatigue significantly dropped after 240 MET minutes per week to about 600 MET minutes per week, which, for reference, is the lower limit of the World Health Organization or WHO recommended energy expenditures for physical activity. But of course, the WHO is looking at people who don't have MS, I think. Between 650 and 1200 MET minutes per week, the upper limit of energy expenditure recommended by the WHO, the influence of exercise on fatigue slowed or stopped. Likewise, a significant response was observed for muscular fitness from 430 to 530 MET minutes per week of exercise. Between 600 and 710 MET minutes per week, the influence of exercise approached 0. In a pooled statistical analysis, a patient's age was found to influence the effects of exercise interventions on fatigue and muscular fitness. At the same time, the duration of a person's disease impacted the effects of exercise on fatigue. The researchers noted several important clinical implications from this analysis, pointing out that the study included a large sample of MS patients and a wide range of exercise types. Given the positive effects of various exercise modalities, healthcare providers should engage in discussions with patients to tailor exercise interventions according to their specific needs, physical abilities, and goals, the team wrote. While large-scale clinical trials are still needed to evaluate the effects of different exercise doses, the researchers noted that overall these studies provide valuable insights to help patients with multiple sclerosis make more informed and personalized decisions regarding exercise regimens tailored to their specific needs. And we can take a look at this article. You might have noticed it was linked from the one we just looked at, but it was published on June 4th of 2024 on the same website, and it was called Resistance Training Exercises May Benefit Middle-Aged MS Patients. Physical regimen showed significant gains in muscle strength. And I know I'm 65, but I like to consider myself middle-aged. I'm just going to be optimistic and say this might even be relevant to me. So I'm going to take a look. They say that resistance training by middle-aged people with multiple sclerosis was linked with significant improvements in muscle strength in a recent meta-analysis of previous clinical trial data. Let's see if what they found relates at all to what the folks in China found when they did their meta-analysis. The analysis indicated the benefits of such training, which is designed to boost strength and endurance, were more variable in fatigue and quality of life. And while resistance training alone didn't significantly improve gait, gains were seen when it was combined with motor-controlled exercises. Healthcare professionals should consider the ongoing use of resistance training-based interventions for this demographic, the study's researchers wrote. And is resistance training an option to improve functionality and muscle strength in middle-aged people with multiple sclerosis? A systematic review and meta-analysis, which was published in the Journal of Clinical Medicine. Okay, so again, this is a meta-analysis, and as we've said, that means they looked at studies that were already published and tried to draw conclusions by looking at them in the aggregate. Still, they say, there is an urgent need for more research efforts in this area, employing larger sample sizes and employing higher quality methods, they said. For most patients, progressive damage to the brain and spinal cord leads to movement problems like gait disturbances, muscle spasms, spasticity, that is, an abnormal increase in muscle tone and spasms, and balance issues. The symptoms can contribute to fatigue, where a person feels exhausted trying to perform daily activities. An appropriate physical exercise regimen is often recommended for MS patients to help prevent or delay functional declines and ease symptoms, offering better physical fitness and quality of life. Among the types of exercise proposed for MS patients is resistance training, which involves activities designed to increase muscle strength and improve endurance, an example being weightlifting. And they talk about reviewing the benefits of resistance training exercises in MS. Studies indicate resistance training may have a range of benefits in MS, including fatigue reduction, increased muscle strength and walking ability, and better life quality. It could be especially beneficial for middle-aged and older patients where symptoms linked to low physical activity, such as spasticity, weakness, and fatigue, are prevalent, wrote the scientists, who conducted a review and meta-analysis of published findings from 12 randomized clinical trials that looked at the effects of resistance training in MS patients aged 45 and older. In a meta-analysis, findings from separate studies are combined to quantify the overall effect of a therapy or intervention across them. The studies involved 459 MS patients with a mean age of 49.7. 6 studies compared resistance training interventions to usual care, while the others compared it to a different type of physical activity such as treadmill training or stretching. Results showed a significant benefit in muscle strength, although different studies looked at strength in various muscle groups, including the lower limbs, hands, or ankles. Resistance training, either alone or with other types of training, was also associated with gait improvements, but the benefits were most pronounced when it was combined with other exercises that involved motor control training. Resistance training on its own was associated with modest but non-significant gait improvements. Observed benefits of resistance training on patients' perceived fatigue and quality of life were variable, and no firm conclusion was drawn. The findings suggest resistance training might have benefits, especially with muscle strength, for middle-aged MS patients. Combinations of resistance training with other forms of exercise, like motor control exercises, might also help. Overall, these findings underscore the potential of resistance training to prevent and ameliorate, that means improve, symptoms of physical functional impairment, offering an opportunity for early intervention to mitigate the impact of MS-related conditions, the researchers wrote. Further research is required to determine the best protocols and patient subgroups that will benefit most from this well-known and easily implemented intervention. I like resistance training because it stretches the muscles and works them, and probably improves blood flow and oxygenation, but it does not raise my heart rate so high that I feel exhausted afterwards. So it's really maybe kind of a mixed bag here. They're really not talking like resistance training is going to do as much for the things that I care about a lot, particularly fatigue. So I might have to look at other exercises to help with that. The other article talks about that too. We'll have to look at these two in conjunction to see if there is an exercise or two that emerges as the winner, if you will. So this last article actually goes backwards in time. It's published on March 14th of 2024 in Multiple Sclerosis News Today. It's called Exercise Improves Mental Health, Life Quality for MS Patients Analysis. Aerobic exercise and resistance training recommended as clinical interventions. Let's see where they got their information from. They say that getting physical exercise can improve subjective well-being and health-related quality of life for people with multiple sclerosis, a new meta-analysis shows. So again, meta-analysis meaning they looked at studies that were already published and tried to draw conclusions from looking at the results of a whole bunch of them. Exercise interventions, especially aerobic or combined aerobic and resistance training, should be implemented in clinical practice to promote mental health and health-related quality of life in people with MS, researchers wrote. The study, The Effect of Exercise on Mental Health and Health-Related Quality of Life in Individuals with Multiple Sclerosis, a Systematic Review and Meta-Analysis, was published in Multiple Sclerosis and Related Disorders. Staying active is an important part of health, with a large body of research showing exercise has both physical and mental benefits for people with MS. Scientists in Italy and Canada conducted a meta-analysis to assess what is known about how exercise affects mental health and life quality for MS patients. A meta-analysis is a type of study where scientists pool data from multiple individual published studies that have already examined a specific outcome. In this case, the effect of exercise on mental health and life quality, and analyze the data collectively. Because they include data on more patients, meta-analyses have more statistical power to detect meaningful effects than single studies. They say that meta-analysis included data from 49 studies, that's a goodly number, involving 2,000 people with MS, and that also is a goodly number. This meta-analysis included data from 49 studies published from 1996 to 2023, covering more than 2,000 people with MS. In each of the studies, some patients were assigned to undertake an exercise program, while other patients either did non-exercise programs or had no intervention. The studies included a range of different types of exercise, including aquatic therapy, Pilates, balance training, strength training, and aerobic exercise. The researchers noted that, generally speaking, most patients were able to stick with exercise programs well, and no major safety issues associated with exercising were reported in most studies. Analyses of all the available data showed consistent evidence suggesting patients who exercised were more likely than those who didn't to report improvements in subjective measures of overall well-being. A fair amount of data indicated patients who participated in exercise programs tended to report improvements in their health-related quality of life and tended to feel more comfortable in social settings. They say that aerobic exercise showed consistent benefits. Aerobic exercise programs, those that raise the heart rate and keep it up, showed an especially consistent effect. The results of our sensitivity analyses support the use of aerobic training as a strategy for improving mental health and health-related quality of life in people with MS, the researchers wrote, noting programs combining aerobic training with strength training also showed consistent mental health benefits. Although these findings broadly reinforce the idea that getting active can be beneficial for MS patients, the researchers noted that in all of the studies included in this analysis, most patients were younger than 65 and didn't have very extensive disability. Therefore, it's unclear whether these findings apply to people with MS who are older or less mobile. And that's kind of important, I would think, especially from where I sit. More studies in people with MS with older than 65 years of age and or with a higher level of impairments are needed before making final inferences on the effectiveness and safety of exercise in such subgroups, the researchers wrote. Well, okay, so I would have to agree with part of this just from my own subjective experience, that some kind of exercise, if it's done consistently, and it almost doesn't matter what. I think the important thing is to be somewhat active, to move every day, whether it's doing household chores or doing an exercise routine, whatever works for you. It does actually help you feel better. Well, you're more oxygenated for one thing. I can't really honestly say that it helps with your fatigue or your muscle fatigue or anything else, your spasticity or any other symptoms that you might have, but your overall contentment in your own body seems to improve because you've moved around some. So that much I will give them. And given that the results of this study seem kind of the same but kind of different from the other studies that we looked at in this set of articles, I don't know that we've got any definitive conclusions yet. Well, let's now just look at a summary slide that I put together that kind of tries to capture the gist of the whole thing. So according to the articles that we looked at today, as best as I can tell, what they're saying the best exercises for these symptoms are as follows. For fatigue, number one seems to be some kind of mind-body exercise, yoga, Pilates. I think stretching would count as this as well, as long as it's like stretching and thinking about your breathing and that kind of thing. Chair yoga, highly recommended. I do that quite a bit. And number two is resistance. So any kind of weight-bearing exercise, whether it's weightlifting or exercise bands or whatever you prefer. And then number three is aerobic, something that gets your heart rate up somewhat. I noticed that they did not include high-intensity interval training, which you'll see below, because that one, even though it is of short duration, the intent is that it would get your heart rate up really high, and I don't like that one for myself personally. Maybe you do. I don't mean to dissuade you from doing it if you enjoy it, but for me, and maybe others too with MS, it's just a little bit too fatiguing. It makes me feel really crummy. But moving down to muscle fitness, if that's your goal, and they do include things like spasticity in here too, high intensity interval training is their number one recommendation, followed by anything else pretty much. So they all tie for second place. And then for mental health or life quality, they like aerobic or resistance, either one. And of course, the caveat with all of this is that results vary according to your age. I would also add in there your general health and also the duration of disease, so how long you've had MS. But I do appreciate that they say here, they stress that more is not necessarily better. So you can overdo it, Or you can reach the point of diminishing returns, which is, I think, more what they're saying, is that you'll get good results with a certain amount, but if you go more than that, it doesn't mean that you're going to continue to get better results, better and better every time. I have to say that all of them pretty much seem to agree that even though they have some tentative conclusions, more research is needed before they're willing to say definitively. But I will tell you right now that any exercise that you do reliably is good exercise, because motion is the most important thing. And those of us with MS, we often don't get very excited about motion or expending energy or getting our heart rate up or what have you. But there's probably some activity that you do either because you feel like it's really important to do, like maybe housework, or you really like to do riding your stationary bicycle or doing yoga or whatever it might be. Any motion is going to be good for you. And that's my advice to you. These studies are great, and I'll keep you posted on new developments as they come along. But in the meantime, you just need to be moving. Don't just sit like a couch potato. I know it's comfy, it's wonderful to do that, it feels good. But in the long run, your body will not thank you for sitting there and doing nothing. Well, I think a good way to end this is to take a few minutes and listen to the wisdom of some recent remarks from Dr. Gavin Giovannoni on the subject of exercise.
There's no doubt that people with multiple sclerosis are susceptible to early aging mechanisms. And the reason is that the brain and spinal cord will age like every other system in the body. And from about the age of 35, there is a well-known normal rate of brain volume loss or atrophy that occurs in healthy people. And anybody who is over the age of 35 or 40 will notice deterioration in their neurological function, even if they don't have MS. Vision deteriorates, hearing, balance, exercise tolerance. This is just part of biology. And the best anti-aging thing we have is lifestyle interventions, particularly exercise. So it's really important that people with multiple sclerosis engage in brain health strategies, and exercise is core to that. And WHO actually say people with MS or general population should exercise, 5 times a week, 30 minutes sessions, so 2.5 hours. And they should do moderate intensity exercise. In other words, get your estimated maximum heart rate up to between 60 and 80% of predicted maximum. That is a bit evidence-based. We know that people who do that kind of exercise have reduced cardiovascular events, and they are generally have a longer life expectancy. And they also have better mental health, and they lower BMIs and all the things that go with that. So there is no doubt that moderate intensity exercise is good. However, there's been work done in rehab environments which showed that high intensity interval training is even better in terms of anti-aging mechanisms. And that's actually a really hard thing to do, because HIIT is you've got to get your heart rate to above 90% of the estimated maximum. So if you want to work out your maximum heart rate, 220 minus your age. So I turned 60 last year. So my maximum heart rate is 160. So I have to do HIIT. I have to get my heart rate, close to 160. And the recommendation is you need to do 3 HIIT sessions a week. They must last 15 minutes. And within the 15 minutes, you have to do 3 sessions where at least for 1 minute of that, you're getting your heart rate up that high. Now, that anybody who does HIIT will know that it's really, really tough. But it's horses for courses. So for some people, walking up a flight of steps is HIIT. For other people, they have to really get on a treadmill or an exercise bike or a rowing machine and really push very hard. And so, my recommendation is if you can do HIIT, try and do HIIT. That doesn't mean you shouldn't do the moderate intensity. You can do both, a hybrid system, because I don't think from a psychological perspective you get enough exercise out of 3 15-minute sessions a week. I wouldn't suggest doing this without getting input from your physio or physical therapist, or your exercise, whoever looks after your exercise programs for you. But so my recommendation will be aim for HIIT. If you can't do HIIT because you're got certain disabilities and you find it impossible or uncomfortable, then go for the moderate intensity interval. But exercise is absolutely crucial, and you may need help or input from a therapist for this.
Well, thank you, Dr. Giovannoni, for your comments on HIIT, because you kind of covered my concerns about it. So I hope that you found that helpful, as I did. Okay, well, I'd be interested to know, do you agree? Are there certain exercises that you've decided you want to do or that you've been doing, and do you find them helpful? Let me know in the comments. I'd really enjoy hearing from you. Well, that's all I have for you today. So until my next video, please do take really good care of yourself. Your general health is so important. I'll see you again in my next video.